Hi, I'm Dr. Yee Kok Meng, consultant cardiologist working in Kuala Lumpur. Coronary artery calcification is basically a condition that happens with age. It's basically due to calcium deposits on the lining of the arteries in the coronary arteries. Now, this is a process where calcium gets deposited and the arteries get hardened. So when we talk about hardening of the arteries, we are referring to coronary calcification. So as we get older, our arteries do become calcified. Now, the degree of calcification does differ from person to person depending on their risk profile. There are many things that can accelerate the calcification in the arteries. People who smoke, for example, are at a higher risk of calcification. People with diabetes, with metabolic syndrome, are also at risk of coronary artery calcification. Other people who are also at risk may include people with hypertension and people with chronic kidney disease. The gold standard in detecting coronary artery calcification is by doing a cardiac CT scan, which will allow us to measure the calcium score. Another device that we have that allows us to tackle this calcified lesion is the use of rotational arterectomy. What is rotational arterectomy? It's basically a drilling device. It's made up of a diamond-coated tip, which basically that allows us to burr through these calcified lesions. What it does is that it rotates at very high speed, approximately 170 to 175,000 RPMs rotation per minute, and that burr will basically shave off the calcium and therefore soften the plaque. So once that is done, that will make the lesion or the blockages more compliant to balloon angioplasty, because once we have shaved off the calcium, the narrowings or blockages are now much softer, and then we can then pass a normal balloon across the lesion and crack it open subsequently. So that's rotational arterectomy. The other option, another newer option that's available nowadays, is the orbital arterectomy. This is yet another device that has allowed us to tackle some of these complex calcified lesions. The orbital device is not dissimilar to the rotational device. It is also made up of a burr which actually rotates or orbits around the vessel. It basically has a sandpaper effect by grinding around the vessel. It's a device that is smaller in profile compared to the rotational arterectomy, and it spins at a slower pace at up to 80,000 or 120,000 RPMs. Okay, so both devices are complementary and can be used to allow us to crack open some of this calcified lesion. A more recent or newer device that we have is the shockwave device. It's basically using lithotripsy technology, ultrasonic waves. By using ultrasonic waves, it allows us to crack open some of these blockages. The ultrasonic emitters are delivered to the lesion like an angioplasty device, basically over a balloon across the lesion, and ultrasonic pulses are emitted to crack open these narrowings. The short answer to this is not. When it's deposited, it's permanent. It's true, when the calcium deposit is already there, there's very little we can do to remove existing calcified plaques. But there's a lot we can do to prevent it from getting worse. For example, if you're a smoker, by stopping cigarette smoking, you can actually reduce significantly your risk of further progression of these calcified arteries. Likewise, if you have diabetes or metabolic syndrome, if you tackle your sugar and control your metabolic indices, you can reduce the calcification process. So controlling your sugar, your blood pressure, your cholesterol are all important ways to reduce your risk of the coronary calcification from getting worse. Treating calcified blockages can be a challenging coronary artery calcification. The gold standard is really by What did I say again?
Standard.